for the Forteo?
Fosamax.
Okay. So we know from previous data that if you've been pre-treated with a bisphosphonate, Forteo works less well, which is why I like to use it first if I possibly can. Not a reason not to use it, but you're going to see a smaller change in bone mineral density. The theory was, when they first started, wow, we'll slow down bone resorption over here, we'll increase bone formation over here, we'll put them together, and we'll get twice the effect. What happened was they got half the effect. And so they said, uh-oh, we misthought this somehow or other. Well, the answer, right or wrong, is explained this way. To make bone, you must first break down bone, so that you can remake more bone. If you block the breakdown of bone entirely, you can't make any more. And so if Fosamax works too well, the Forteo's benefit is going to be diminished. At least that's the rationale for why it didn't work when you put them together. Now there's a more recent study that says you can put them together and they work better. So we're still up in the air about the whole question. Yes?
Is there any way to measure bone turnover
Yes.
with a marker?
Yes. You can measure urine N-telopeptide, you can measure serum C-telopeptide, you can measure, got the other name, there's another procollagen peptide. So you can measure these things as a marker of bone turnover. We used to do this in all clinical trials way back when to say, okay, let's treat the people with high bone turnover. Well, you know what? These levels are not high in the majority of patients. They're just inappropriately high. And so you can measure them and you can demonstrate for Prolia, for Reclass, for Fosamax, for Actonel, for Boniva, it will reduce bone turnover markers by 50 to 70%. Okay? In fact, all clinical trials show these numbers. I didn't put them up there because it's fairly complex and it's not terribly relevant because we don't measure them all the time. It's a clinical research tool. You want to suppress bone turnover down to the normal range, but you don't want to suppress it entirely because what I said is you have to have bone turnover to have bones that are not brittle. This is always the concern about how long should you be on therapy. Because if you take Fosamax for 10 years, are your bones brittle now because you haven't remodeled them enough? And so the current guidelines are, and nobody asked me this question, so I'm coming up with this myself. At 5 years, if your bone density is dramatically improved and you've done well, and your bone density is now not so bad, take a vacation. If at 5 years your bone density is improved, but you're still very high risk, keep taking it. At 7 years, rethink this. Maybe you need a holiday at 7 years. So we don't think you should be on bisphosphonates for life. So somewhere between 5 and 10 years, it's time for a break. And you stop it for a while, not a break in bone, but a break in drug. And then at the end of that time, repeat the bone density in a year or two. If you've declined again, reinstitute the same therapy or a different therapy, because now we have different classes to use. So I think that's where I am these days, and a lot of patients that I see now, they've been on drugs for 10 years, and now we're stopping, taking a break, and then do something else later on, or come back and do the same thing later on. Yeah.
Because how do people come to you and say, I think I've got osteoporosis?
Yes, actually. More often they come because they have a test somewhere that somebody says they have osteoporosis.
That's what I'm wondering. Can you walk around and say, gee, by golly, I've got that?
No. That's the short answer to that question. So what clinical clues can you have to osteoporosis without having a test done? And the answer is really pretty much two. You got shorter, or you broke something without trying. Those are the two clinical clues. So if you lost more than 1.5 inches in height, you have osteoporosis, by definition. So if you got shorter, if you got measured in the doctor's office and you used to think you were 5'3" and now you're 4'9", you have osteoporosis.
No,
People lost that much height, believe me, it's not so unusual.
You may have had that many hip replacements.
Well, your hips might make you taller. You can't tell what kind of hip replacement they put in there.
Well, the new ones add 1/4 of an inch, but the old ones used to take away 1/4 of an inch.
So those are the only ways that you can know clinically. Now, you could have had a chest x-ray, which the radiologist says, I see osteoporosis on the chest x-ray. Could have been found incidentally in some other way. Otherwise, what you do is you go to your primary care doctor and say, or your gynecologist, say, I need a bone density. I'm worried about my bones. That's the simplest test. That will tell you better than just kind of trying to guess at what it was. Before we had a DEXA, we treated hardly anybody. We didn't know until you broke something. Yes?
Is the development of the dowager's hump, that odd posture, an indication of this also?
Yes. Very, very likely to be the case. Because your neck goes forward because your spine goes this way, and you've accentuated your curvature, which can just be arthritis, but typically can be osteoporosis as well. So you'll see people walking around who cannot get their head up straight, right? I mean, they're walking along with their walker, and all they can see is the floor. There's no way on earth they can get their head up straight to look forward.
And you're ready to treat it?
Yeah, but I'd like to treat them before then, if I possibly could. There's not much I can do at that point in time. I can't make them straighter. Yes?
One of the things that I see from my brother is 73, is, and I say, you don't do this, is he has a tendency to pitch forward, and he doesn't have to. All I have to do is remind him to stand straight, and he does. Is there any way that you can determine whether he needs some help, or?
I mean, I think in that situation, it's reasonable to look at a DEXA. This may be a muscular problem or a balance problem as well. And you see people say, well, if I just straighten out my shoulders, I'll fix my back. It's kind of hard to think about walking around like this all the time if they keep your back straight, but I think it's reasonable to look at the question. You know, it clearly throws off your balance if your spine is now in the wrong direction. I have a lot of older women who come to see me and say, I haven't gained any weight, but I got a big stomach. I can't get rid of my big stomach. I said, well, it's not your big stomach, because your back pushing in too far, no place for your intestines to go, they're just being pushed forward. They don't like that answer.
Dr. Mersey, thank you very much for an
Thank you.
excellent talk. Really enjoyed it. And we hope that we captured every word so we can put the video up on our website. So that's our next goal. And